All right, hey guys, D'Angelo here with Practice Biopsy, and today I have a great guest with us. This is Dr. Scott Waltman, and he is the author of a book that I have greatly enjoyed recently, and it is called Socratic Questioning for Therapists and Counselors. So you guys all know as dentists that we work with patients all the time, and a huge part of our job is communicating. It's not like the old days where you say, I'm the doctor, you need to do this, and people just sit down and do it. It's not how it works. So I have been studying and seeking a better way to communicate. And this is when I came across this book. And I've got some notes here, guys, that I'm going to be referring to. But Scott, I collect like data on my patients when they fill out their initial paperwork. And I asked, one of the key questions I asked them is, what are you looking for in your dentist?
Awesome.
You know, first visit, I said, what are you looking for? And there's trends that I've noticed. And some of the common ones are someone that I can trust, someone that's not going to rip them off, someone who won't lecture me, someone who won't do procedures that don't really need to be done is a really common one. Someone who won't hurt them. So a trend I see is like a huge issue with trust and a huge issue with fear, whether that's fear of pain or the fear of being taken advantage of. Just to set the stage a little bit more for dentistry, a lot of dental health care, I like to tell people our profession is kind of like a profession of neglect. So a lot of needs in dental health care with routine maintenance, good hygiene habits at home, catching small problems when they're early, they can all be avoided, but a lot of that doesn't happen. And that's when you end up needing major dental work, you know, needing more invasive procedures done. But if we take care of things early, it doesn't get to that point. And I feel like this neglect comes from fear, comes from lack of knowledge, which maybe is based in a lack of trust and communication between the patient and the dentist. And I really liked your approach that you focused on in your book with the Socratic method, because it focuses on asking the patient or the client questions and not lecturing, and allowing the patient to come to and discover and really own their own choices. So after that little spiel to you, I just kind of want to have you give a little brief intro of yourself, history of your work, what's a typical day in the life of your work day, and what specifically was your motivation to write a book on this topic?
Oh, this is fun. All my favorite topics. Cool. Yes, I'm a psychologist. Currently, I work in a public mental health system. I also have a private practice on the side, because if you work in public mental health system, it's good to have a private practice to help things work. So most of my training has been a type of therapy called cognitive behavior therapy, which is a research supported therapy. It's very practical. It's focused on goals and focused on working towards those goals. Previously, I was a CBT trainer, both in a large LA County program and then in the city of Philadelphia. There was a similar program. And I was talking with the other trainers once, and I was like, have you noticed that we kind of give the same feedback over and over and over to our people? And I wondered, like, is there a way we could like study and figure out what's the feedback we're giving people and give it to them in advance? So that way, instead of trying to, like you're saying, instead of trying to catch it on the back end, let's catch it on the front end.
Yeah.
And so we did a big study across with trainers from across the country. And what we found was Socratic questioning is kind of like the hardest skill for people to learn. A lot across the board, people fall into habits of a lot of advice giving, a lot of telling people what to do, a lot of giving people the answers. And although they give people good answers, if it's too easy, people don't really take it in, right? If it seems like it's not coming from a place of really understanding the person's problem. And so from that, we retooled how we taught the skill, and then we wanted to get the framework out to people, because we said, well, we put the work into retooling it. Let's see if we can get people get some access to it.
Right. What was the process of like the book writing? How long did it take?
I mean, it was fairly fast, but I think part of the reason it was fairly fast was because it's written in a very clinically applied manner. So it wasn't, so it's basically like, here's the principle, here's the idea behind it, here's what it looks like with an example, and then debriefing it. So there are 16, 17 chapters in the book?
Give or take, yeah.
Yeah. So I think I wrote my chapters, kind of like one chapter every 2 weeks or so. My co-authors took a little bit faster, but that's good. It's good to have people who have different skills.
Yeah.
Some people are kind of faster, some people are kind of slower. But it was fun to write. I mean, it was. I think whenever you're paying attention to something, like right now you're paying attention to like health behaviors, how do we communicate with people? It makes you more cognizant of it. As you're more cognizant of it, it kind of changes the way you interact, what you learn, what you pay attention to. So, spending that time really focusing on Socratic questioning really also not just helped us write about it, but helped us refine our process as well, which is nice. So I feel like I'm better at it.
Because it forces you to reflect as you're working through the book, I assume.
Yeah. Yeah. And then after a session, if it went really well, you're like, why did that go so well? And if it went really poorly, you're like, how did I screw that up? Yeah.
Why? And yeah. And sometimes like when I'm working with a patient, I'll reflect on that now, because I'm working on actually coming up with a system of communication, because dentists, we don't really have that. So sometimes I'll sit with the patient, think a dialogue went great, and I'm gonna assume they're gonna go schedule their appointment to get their treatment done, and I never see them again. Wow, what went wrong? And then another person, I'm like, okay, that interaction went fairly well, and then they show up for everything, and they think we're the best place ever, and you're like, well, what's the difference? So I've spent a lot of energy really looking into it. I just want to go back a quick second. I want to touch on something you said about your book that I want to compliment, because I really like this in a book, and I don't find it in a lot of books. You can see by my shelf, I read a lot of books.
Yeah, that's a good shelf.
You don't just spell it out. I love that you give examples, and you don't just give examples in the book like maybe a situation like this could happen. You give examples in the book, and then you actually show the dialogue. This is what the therapist says. This is what the client says. This is what the therapist says. This is what the client says. And then you step back and break it down. So that's one of the things that I enjoyed the most about this book, is because I could really say, oh, you know what? I'm a dentist, not a therapist, but I have conversations like this. And it made it really easy for me to apply to my day-to-day work. Something I want to get into on my list of questions is, first off, how do you formulate a quality question as a therapist working with a client? Like, what makes a good question?
I love this question. Oh, questions about questions. This is fun. I think a lot of times people, they want they almost want like a list of questions, right? They want to know like, what are the key questions to ask?
Right.
But I think really a good question comes from really understanding. So if you're listening to the client and you're trying to understand what's going on for them, then basically the shift from our framework to other frameworks is a lot of folks are focused on almost like trying to approach it like as a litigator. How can I take apart the patient's argument? How can I show them that they're wrong?
Right.
It turns out people don't like that.
No.
And it kind of makes people dig in deeper. But so the shift is instead try to understand it from their point of view first. And once you see it from their point of view first, then we can try and find a good question to come at it, right? So let's say you're working at something like flossing, right? So instead of being like, well, you really should be flossing every day, it's actually more important than brushing, all this stuff, the person's like, yeah. But if you approach that, so tell me about your relationship with flossing. Like, tell me about when it's easier for you to floss and harder for you to floss. Tell me about what you like and don't like about it, right? Then from there, you can try and understand what's the barrier. And when you understand the barrier, then you can start being curious about that.
Okay.
So I think if you can be genuinely curious, that's going to get you a lot further than having the exact right words.
So you ask them these open-ended questions, like, tell me how you feel about, if it's a new client, I assume that maybe they don't even tell you the truth right away, or maybe they have some barriers with you. So what techniques do you have, or thoughts do you have about you yourself being able to establish enough trust with the client so that they're open enough where they'll be truthful enough where you can actually make some ground on these questions?
I love you have so many good questions. I love this. I think there's a few things to think about. Let me try and organize my thoughts.
Yeah.
So there's some good data from Al Bandura from the modeling person back in the 60s and 70s, but still very good research showing that an imperfect model works better than a perfect model, right? So the humanity, right? What makes us human? What makes us interesting? What makes us flawed in a way is what makes us relatable. So you're, as a dentist, or as a clinician, I always say our most important tool is ourselves, right? So really trying to connect in an authentic and human way is going to get you pretty far. Really trying to care about the person is going to get you pretty far. as far as like coming out trying to get them to tell you the truth and stuff, so there is research in the field of CBT for bipolar disorder. They've done a really good job looking at this, and what they found is that things that people often aren't exactly forthright isn't the right word, but places where you might not get all the information would be like how are you taking your meds is a place where people often aren't really compliant with it. But then there's good data showing that even people who take like blood pressure medicine or omegas don't take it regularly.
Yeah.
But if they approach it as more like a, well, tell when is it easier, when is it harder to take your meds, then it's not right or wrong, right? Then it's not all or nothing.
Okay. So avoid setting up like a right or wrong, black and white, all or nothing dynamic with them.
Yeah. So
maybe that like backs them into a corner, maybe.
It does, right? Because I think people kind of smooth over the corners, right? Like if I had a friend who was a cop and he was like, oh, "So you never speed, right?" I'd be like, "Yeah, of course I never speed, right?" But in reality, I'd be like, "Well, I try not to speed when I know it's dangerous."
Versus if he's like, when what type of roads do you find yourself, going a little faster?
Yeah, that's a better question, right? Because then it's not like we're on the same level. Okay, he maybe speeds sometimes too. This is okay. We're two humans now.
Okay. I like that. Let's see here. What do I have next time here that can build off of that? So do you have like, when you're meeting a new client, I'm focusing right now more on like meeting a new client, but I'm working to a broader view from that. Do you have, this kind of goes to like establishing trust and building the early relationship with them. Do you have like an opening line when you sit down with them, like that's your go-to versus like, "Hey, you're new. What's up? What brings you in?" Do you have like a groundwork that you lay with a new person to set the tone for the relationship?
That's fun. I like that. So I think usually, I don't know. I don't think, I maybe have some kind of spiel, but typically when I'm first sitting down with someone, I'm trying to orient them to just me as a person, me as a clinician, and how I'm going to work with them. Because usually, at least in therapy, right? It's unusual for me to get someone who hasn't had a previous therapist. Like I'm sure you get people and they've had previous dentists, so it's useful. So I'll talk with them about how I work. This is how other people work, why I do what I do, just trying to let people know here's what's going to happen.
Can you give me an example? Like, can you pretend that I'm your client? Like,
yeah.
Hi.
Oh, DeAngelis, nice to meet you. I'm so glad you came in.
Nice to meet you too, Scott.
Yeah. Any trouble finding the place?
No, it's pretty straightforward.
Okay. Yeah, we got a good office here. I'm happy about it. So DeAngelo, I want to get to know you better, and also I want to talk a little bit about how I work. So I know there's different kinds of therapists. You might have seen therapists on TV or movies or had previous therapists, and we all kind of work differently, and it can be sort of confusing on the client's end or on the patient's end. It's hard to know kind of what are you getting into. So I don't want to make this mysterious. I don't want to make it so you're trying to read my mind or figure out what's going on. So I just want to be transparent with you. So I work from a kind of therapy called cognitive behavior therapy. It's a research supported therapy. The basic idea behind it is that how we're thinking affects what we do and how we feel. And so it's a skills-based strategy. So part of therapy is me getting to know you better, but also me trying to figure out what do I think are the problems that are getting in the way? And if we can figure out what those problems are, then can I teach you skills to help us overcome those problems?
Okay. So you give like a little introduction of yourself, which in a way like shows where some of your barriers are and actually lets down some of those barriers a little bit, maybe invites them to do the same. Okay.
Yeah. Well, I think, the idea is to try to anticipate what do I think the questions that they're going to have are, and then try and get at those in advance.
Try to like build them in to that communication.
Right. Like if someone has fears that you're going to try and be upselling them on stuff, right? If you're saying, look, this isn't a cosmetic dentistry place, I'm not trying to sell you stuff you don't necessarily need. This is what I'm really focused on here. There's a chance for someone to say, okay, that's who you are. Great. I don't have to have that worry.
Okay. Something that you touched on in your little spiel just there that I really liked from your book was they focus on skills teaching to your client, like teaching them certain skills, and that helps them like in the discovery process. If you could talk a little bit more about that, and an example I came up with, you can tell me if this is a good application of it. So something that I've tried to implement is like teaching them the skill to read dental x-rays.
Okay.
So when dental x-rays come up, most people don't know what they're looking at. So I try to teach them like the basic fundamentals, like this part means this part means this. Knowing that now, what do you see? And then get them to try and maybe self-diagnose some of the problems that I'm going to introduce. Is that a good grasp on the skills teaching component that you talk about, or am I landing on it properly?
Yeah, I think it certainly falls in the realm of, I think it feels it's skills training, but it might be better categorized as like creating like a shared conceptualization of the problem, right? So
Okay.
instead of them sitting down and you saying like, here's the problem, here's what we're going to do about it, but you're trying to show them, because if the idea is that that there's barriers to trust,
Yes.
then you're not gonna be the Wizard of Oz, but you're gonna say like, here's what's going on, right? I'm not magic. This is science. I can teach you this, right? The attitude of, if I can learn this, you can learn this too. I can
Yeah.
teach you how to do this. Can be pretty helpful. And I imagine your patients like that, right? I imagine your patients being like, oh, this is interesting.
Yeah.
And they probably are like, oh, what's this? What's this? And maybe it probably takes a little extra time to do it, but they might like you more because of it.
I think so. I hope so. With the barrier to trust, I often think that like that barrier is up for a reason. Like maybe a dental office or the dentist in the past that they've had, or maybe just like a staff member in passing in a dental office they had. Like a violation of trust perhaps occurred in the past, which is why they have the issue now. How much do I want to actually go into that previous issue versus just setting the tone for this is going to be good now that you're here?
Yeah. Right. So as a therapist, it might be different than as a dentist, right? So as a therapist, like we need the relationship is a key part of how therapy works, and so it's important that we have that. So we spend a lot of time talking about, who you worked with in the past, how did that go, what did you like, what did you not like, what seemed to be helpful, what didn't seem to be helpful. Is there anything that they did that definitely didn't work that I should not do with you?
Okay, yeah, I like that one. Is there anything that they did that didn't work, basically, so we don't repeat that trigger? Generalizations. So I want some help from you on how to break down generalizations that they might have. We talked about opening lines. A common opening line from the patient end, so they'll sit down and they'll say, "Hi, I know I've never met you before, but I hate dentists." Step one.
Yeah, you're like an IRS auditor where they're like, "What are you doing here?"
So, what's your advice for handling that? Just met you. I want you to know that I hate dentists.
Okay. Right. So different ways to go with it, right? So you could kind of join with them irreverently and be like, yeah, I hate dentists too. They're a bunch of assholes, and then kind of move on from it. Which if you had the right personality, might work.
Yeah.
I mean, there's a lot of things that we do that isn't exactly fun. And if people are like, I hate this, I might say, well, that makes sense. It'd be kind of weird if you really loved coming to the dentist. That'd be a whole different problem.
Yeah. Yeah. Maybe you like to get a little bit of a laugh out of them.
Yeah. Because you're trying to show, because really they're seeing like, are you safe, right? And they're letting you know like, I'm uncomfortable.
Yeah.
And you're being like, yeah, I get that, and like, let me show you that I'm a human here too. But if you make a joke and they're like, no, I really hate being here, then there's a chance, because dental anxiety is a pretty major thing.
It's pretty major, yeah.
Yeah. So there's a lot of places that have like psychologists or social workers that work with them as well to help reduce dental anxiety or work through it. And that's a real thing to think about. And there can be, various traumas in the person's life, not just dental traumas, but various traumas in their life that make them anxious and on guard. So if someone's feeling anxious, and if you're from a CBT perspective, the idea is we want to conceptualize the problem before we try and do something about it. So if the person says, I don't like dentists, you're trying to read into them, like, is this like an anxiety thing? Do they look like they feel unsafe right now? Because if they do look like they feel unsafe, then you might just slow down, try and help them feel more safe. If they look like they're anxious, you might ask them if there's anything they do that helps themselves calm down.
Okay.
They need a minute to breathe. They need a minute. Would it help if you turn on the radio? Would it help if you do some breaths with them? Would it help if they got to know you better?
Right. Just try and figure it out. A question that I've been, because your books made me say, like, think question first. Question first, not answer first. So when I get I hate the dentist, which is several times a week, I have a question that I've been using. I want your feedback on, like, if it's a good question or if you would change something about it. So when they go, I hate the dentist, a question that I might ask might be, well, if you hate the dentist, if you hate the dentist, you must have a really good reason for getting in your car and driving to the dentist today. So what's going on?
Okay. Yeah, that's a good question. And that you're highlighting, you'd probably rather be anywhere than here.
Yeah, you'd probably rather be anywhere but here, but Here you are. So what's going on?
Yeah, and I like how you recognize it's not personal, right? They're not saying I hate you.
Yeah.
They're saying like this to me is invasive and unpleasant and painful, and I hate it. Yeah. So I think you could go that way if you're trying to move into kind of more like goal focus on what are we working on here. If you were looking for like a option B, right? Option B, you might try and figure out, well, what's the worst part about the dentist for you, right? What do you hate the most about the dentist?
Yeah.
Because there you might be able to figure out what's the soft spot, right? Is it they're going to say like they're always rude, they never listen, they make my teeth, my gums bleed, they're so expensive and I can never afford it, and I feel like I'm drowning in debt already.
Yeah.
So if you can try and get at the concern, you can try and address it.
Okay. So really uncovering, what are your, like, some people, I guess goes back to like establishing trust with your client, but just the people who like have a lot of like protective layers to not really want to give that information. How do you get through to them as a client? Is it
Well, you
just
can't,
time or?
yeah, you can't force it, right? So if someone, if you're trying to address a concern with someone and you're having a hard time getting there, some people call it resistance, but it's helpful to recognize it as reluctance instead of resistance, right? To recognize like they're just not, we're not there, and that's fine. We have time, right? Unless it's like an emergency dental procedure, we have time to take it slow.
Okay. With the Socratic framework, there's the focusing, the validation, the collaborative curiosity, and then summary and synthesis. Is there a step that you feel like maybe even therapists or clients want to skip over out of those steps? Is there something where like you find people kind of want to skip one of those steps sometimes?
Yeah, I would say therapists definitely. Actually, I have a graphic. Hang on, let me see if I can share this. Let me see if I can do this. Did I do this right? Oh, there you go. I'm not able to share the screen. I apologize. I was like, oh, I could have a graphic ready for this. That'd be fun.
Yeah. Yeah, I don't know if I can let you share it.
Okay, that's fine. That's totally fine.
Good.
So focusing, understanding, curiosity, summary, and synthesis. So the places that the pitfalls clinicians fall into, right? A lot of times, so if you think about focusing, is the idea is we don't have time to go after everything, right? So we can't, any thought, every barb, every fear that comes up, we don't have time to get into all of it. Even as therapists, we don't have time to get into all of it. So if we go after everything, then we have very little depth and a lot of breadth, which isn't as helpful as a lot of depth in the key issue. So the focusing idea is we want to figure out what are we really going after here instead of going after stuff that's shiny or interesting. Which is the idea of when they talk about not hating the dentist, going, well, what's the worst part about it, right? We're going to try and let's focus on what really matters. Understanding is the part that people often want to skip. They often want to jump to, well, let me show you why that's not a problem. Let me show you why you're wrong. Let me show you. But if you can say, well, how'd you come to, what experiences led to this? Help me understand how this makes sense. If you can hold on to the idea that it has to make sense, right? People come by their beliefs honestly. Then once you get it from their point of view, it's going to be easier to unpack it. Okay.
So the understanding and validation is the one where you find is most often skipped over.
Yeah, that one's and then usually there's some kind of emotional catharsis once you highlight like kind of what they might be missing, but then people skip summary synthesis where you pull it back together to, okay, so what are we going to do about this? What does this mean? What's the main idea?
And they want you. Do you find clients want you to give them the answer? Like, okay, Dr. Waltman, what do I have to do though to get better?
Yeah, well, I think
like, how often do you just say, okay, I see this is going on with your life, got to change this, versus, well, let's ask some more questions and see if I can get them to figure it out.
Yeah, I think a lot of times people do want the answer, but I don't think, but then when you give it to them, it's not like they're like, oh, thanks, I'm going to take this with me, right? But it's more, yeah, it's almost paradoxical where people want answers, but like if you give them to them, they're like, this isn't really it. Because if you just give them the answer, it might not be the right answer because you don't understand the situation.
Right.
So you kind of have to go through the discovery with them to be able to see, oh, I totally missed this. I totally missed this. I'm glad we talked about this.
Do you know if there's like any research like on why, like if you just say, hey, this is the answer, it doesn't stick with them as well as if they figure it out through questioning? Like the why behind it?
Yeah. I mean, so I mean, personally, I think it's more about kind of the emotional schema that goes underneath it. Because I think if you just talk about it just logically you don't really get into it, you get people being like, yeah, intellectually, I know I'm good enough, but emotionally, I feel like like no one will ever love me. But when we really go through it, when they access the emotions of it, then we can get like change on not just a cognitive level, but like the emotional schema. And then it's a longer road to get there, but then it's a more lasting change.
Okay. Okay. When you're asking questions, sometimes I like think through sample questions. I'm like, oh, that's not a good one. How do you avoid like a question sounding condescending? Because I feel like sometimes if you ask the wrong question, it can sound condescending to the client or to the patient.
Oh, absolutely, absolutely.
So what are some like no-nos or red flags or tips for asking a good question that like validates them and moves us forward, but doesn't come across as a condescending question or whatever else a pitfall of a question could be?
Yeah, that's good. I love that question. So there are like prohibitions, right? So people say like you should never ask your client why, but that's dumb. You can definitely ask people why, but I think it's more has to do like what's the intention behind the question. Like if you're asking a question and the idea is you're trying to show them why they're wrong, or you're trying to like it's a question with a very obvious answer.
Yeah, the leading question.
Yeah, people are going to pick up on that and they'll be like, yeah, I fucking know that. Get off my back. Or I don't know if I'm allowed to swear on this or not. I apologize.
You're all good.
Dentists are all grown-ups, right?
We're all grown-ups in the group.
Okay.
Okay. Is there ever a time when you would ask a leading question?
I think I mean, sometimes there's an urge to ask a leading question. And in those cases, I might ask the client, like, what do you think I'm thinking right now? Or what do you think I'm going to say about that? And that can be kind of like a one-off. Because usually like, they know, right? You can be like, well, you know what I think about that, right? Or you know what I'm going to say about that. Or there's a chance then to be like, yeah, I know. Okay. So what am I going to say? You're going to say that he's married and I'm an idiot for chasing him. I wasn't going to say it like that, but now that you say that, how does that sound to you? Yeah, I guess that makes sense. Okay.
Yeah. Okay. All right. So kind of on that, like as far as using questions to like open up topics, how would you use questions, maybe even give an example or tell a story? A patient has a problem, something going on. You're pretty sure you know what it is, but they have no clue. Like they've got no idea. You can see something that you think going on, but they haven't even thought of it. How do you get them there? How do you guide them?
Yeah, I like that. And so let me talk about an example and also share kind of an idea as well. So the idea first is that you can't really guide someone to something that they just don't know, right? So if people don't understand like the biochemistry of some kind of dental procedure, you can't walk them through like dental school in your appointment. You don't have time for that. So things that often happen is there's often a lot things that happen in context, and it's hard for people to understand the context of it when they're younger. So for example, something that commonly comes up and just came up in one of my most previous sessions was someone trauma kind of travels through families. So this young man grew up feeling like his father never really loved him. He was never really good enough for him. As we're talking about him, it's very obvious to me that your dad sounds like he has like a lot of PTSD. And what we know about PTSD is it's overactivation of the threat perception system. You're chronically in survival mode. When you're chronically in survival mode, you're not feeling connected to people. You're not feeling love. You're not really able to express that love to other people because you're just constantly on guard and feel like you're going to die, people you care about die. So he has this idea like I was never really good enough for my dad. And to me, I'm like, well, I think the reason your dad felt emotionally distant is because he has PTSD. This isn't a you thing. This is a him thing.
But you don't tell the client this.
Well, I can't. I mean, you want to say like, duh, look at this, but that's not going to work, right? But what you can say is you can say, so how did you make sense of this when you were younger? What was your thought pattern behind this? And then I say, well, I feel like I was never really good enough. I never really measured up. And then there's a chance for you to say, well, let me provide a little bit of information. I don't know if this is what's going on or not, but let me provide a little information and let's see how this works out. So some information to know is that how a trauma affects the brain and how that in turn affects relationships. and then there's a chance to provide some psychoeducation about that. And then you say, but then we want to still pull back and be kind of Socratic and say, well, if that was going on, how would we know if that was true? So you can be kind of, you can kind of check the evidence on the front end or the back end.
Okay.
So a nice way when you're sort of giving the answer is to be able to say, if this was true, here's what would be the signs of that. And then you can say, let's look together, see if we're seeing the signs of that. And there's a chance for them to still be part of the partnership and go, oh, you know what? I think you're right. You go, yeah, okay, that makes sense. Sometimes I'm wrong though.
I remember a part in the book, like establishing like a shared definition or shared truth. There's part in the book where the therapist and the client like went to the dictionary and like looked up a definition of a word that the patient kept using, referring to themselves. And they're like, oh, maybe that's really, I'm not using the right terminology, which kind of, revamped the whole conversation. Do you find when you're communicating with the client, what role does like storytelling play? Like, do you ever give like examples of other clients like anonymously and say, well, let me set the stage. There was someone who did this, or do you ever find a value in like having them tell a story and then picking out information from that story that's helpful to your sessions? Just the role of storytelling.
Yeah, I think storytelling, I think story metaphor is really powerful. I think metaphor is a really powerful tool for communicating complex ideas in a practical way. Storytelling about one patient's story to another patient is murky, right? I don't do that personally just because I think.
Yeah, why not?
Well, because I think that my client would then be like, wait, do you tell people about my stuff then? I think because if I was them, right? Like anytime, like I remember I was having a procedure done and the whole time the physician was telling me about the last patients, like what was going on with their life and using them as like a beware story. And I was like, okay, I know like too much about this person. Like I don't trust you right now. I don't feel safe.
Okay.
But if you can speak more generally of like sometimes this happens for people, then it's not like, hey, there's this guy. Not
say, hey, there's this guy. But sometimes what happens with clients that I've had.
Yeah.
Because if you say, hey, this guy, then you're feeling like you're building up like this whole legend of this person. Like I don't know them, but I feel like I know them and I shouldn't know this stuff about them.
Right. And am I going to be the next guy in your next story?
Yeah, I'm going to be the next guy in the story.
Yeah, no one wants to be that. And I think if you say like sometimes my clients, sometimes I think it's even more powerful if you say sometimes my clients tell me that this is what happens for them. And then you're kind of carrying forward, like this isn't just like my observations, but like people say this. And I think that there's some weight to this
because someone who's a client like me also thinks this. Okay, I like that. How do you know when like you've gotten through or succeeded with a client? Like how do you know when you've gotten through and succeeded on a problem?
Oh, is this like across a whole course of therapy or like across like a certain like Socratic dialogue?
Certain Socratic dialogue.
Okay, that's more manageable. In my mind, I think about Socratic processes and Socratic questioning as a process of.
Let me interject real quick, just to make it a little more. Let's say that you've got a client who she has like problems with her dad, and she blames that for a problem in her personal life now, and she can't let that go. I totally made that up. It's not based on anything.
Okay.
How do you know if you've like gotten through and wrapped up this issue so that they can move on with life?
Well, I mean, the real change would be change in behavior then, right? It's not just, but across the communication we'd have, right? You look at, did we break the situation down? Did we put it back together in a new way? Does she have a new way of looking at it? And then is she going to do something different because of that? And that's the real point of the subbrain synthesis step, is to say, okay, so if we're seeing it differently, what are you going to do differently? But then people have to go do different experiences to create a different life, to then start really shaping into kind of this new beliefs they're building up. Okay.
So you base it on like, are they able to summarize and understand it? Do they have a plan for the new action they're going to take? And then do they actually take that action? And then, so maybe they come back to you and you say, so did you take that action? And they say no. Then you need to go back to the laboratory and dig a little deeper.
Yeah. Well, so the first thing would be, before they go out with the plan, you try and problem solve it with them, because even the best laid plans fall apart. So we're trying to figure out how are we going to make this work, and how does it typically break down for you?
Yeah.
And then if it didn't work, it's still data, right? Okay, so we have data that you meant to do this and you didn't do this. Awesome. What did we learn, right? What came up? What got in the way? Where did it break down? We can have a better plan next time because of this. So we're always, one of my favorite things about CBT is it's all data. So whatever happens, we learn, we refine, we learn, we refine.
Okay. Something that I like just as a dentist, and probably like most dentists, like have to like maybe come to grips with a little better. I'm interested in your perspective. So like in a bubble, sit down, the patient opens their mouth, take x-rays. I see what's going on. My goal is to fix all the cavities, clear up all their gum disease, make everything with their teeth healthy. But that's not always the goal the patient comes in with. Their goal might be, oh, I don't care about any of that stuff. I have this front tooth that's crooked. I just want you to fix that. I'm like, what about all the other problems? Because those are maybe my priorities. So I feel like I have my priorities. The patient has their priorities. But I feel like, I'm the dentist. I know what needs to be done to establish health. So how do I meet them with that? If someone comes in and says, my teeth are great, I don't need anything really done, I just want my teeth cleaned. But I look and I say, oh, I know that's not true. So how would I tackle that?
Yeah, I think that's a challenging place to be. The strategy would be to try and align with them and try and figure out kind of what's the shared goal. Because if you're trying to, if they're saying, look, I don't want that, I only want this, you're gonna have a really hard time trying to say, well, here's everything that's wrong and here's what we need to do about it. And all of a sudden it's like when you're getting your oil changed and then they're telling you like you need to like get your rear differential done. You're like, I don't even know what a rear differential is.
Yeah. And before you get into like your better answer, like a deeper answer on it, I want to give an example. This is actually something I read in like a dentist social media group. He was like sharing a story. And he basically shared that like he had a patient come in, like it was about a year ago, and he noticed like a spot on his face. And he was like, hey, that looks like it could be precancerous. You should go get that checked out. And the guy was basically like, you're a dentist. Like, what do you know about this? And he didn't go get it checked out. And then it got worse. It was cancer and he died.
Okay.
So like there was a huge, like if that dentist was able to establish rapport and trust and say, hey, I actually know what I'm talking about. That's probably cancer. He'd still be here. Like there's real consequences sometimes in healthcare to not being able to establish trust and coming to a truth that will be best for your health. So, I struggle with trying to kind of cross that bridge with someone who says, I'm totally healthy, when maybe the evidence shows they're not.
Right. Yeah. And I think if you were trying to back it up, right, we try and think about is the reason that someone's saying I'm totally healthy that because they actually think they're totally healthy? Is this an access to care issue? Is this like a being able to afford care issue? Because my guess is people who are saying like only do this, it's probably because they're like, I can't even afford to get my teeth cleaned. I definitely can't afford this other stuff.
Yeah.
So if we're thinking that so if I was trying to think a compassionate conceptualization, my assumption would be that it's not just like willful ignorance on the part of the client. My assumption would be that if people are saying like, I only want this, it's because they're afraid they can't afford more. So if that's the case, right, if I'm saying like, I know you might be afraid of the cost of getting this checked out. I can have the front desk people look up some low cost options about places that might be a good place to get a screening done. So the idea is trying to think about how does it make perfect sense, right? Because the idea that people are coming in and they're just like saying like, look, you don't know anything you're doing. You're just I don't even know what a slur for dentist is. Like teeth jockey. I don't even know.
Yeah, you'll go with that, teeth jockey.
Yeah. What was it in Seinfeld? The anti-dentite. You're an anti-dentite.
Like that, yeah.
All right. So I think you probably don't get a lot of those. I imagine that I imagine it's either fear or costs or some other reason that's getting in the way. And then I would try and see like, what do I think is getting in the way of it?
Yeah.
If I was kind of broadly trying to think about like what's the shared goal, I think if you're trying to say like shifting from kind of what's the main thing you want to work on to trying to help the client or try to ask the client to prioritize. So, these are different things that we might work on together. What do you want to prioritize? And then there's a chance for you to say, well, I know that this isn't your top priority, but this is still important. Let's think about how we might approach this. Because then
I like that.
you're avoiding a frame of it being like just this one thing.
Okay. How do you, what skills or tips do you have for finding and identifying the hot thought for a person?
Yeah, so the hot thought would be
and then can you like sorry, tell our listeners like what is a hot thought?
Yeah, sure. So the idea is the cognitive model. So how you think affects how you feel and what you do. The idea of the hot thought is this is the thought that seems to be really driving the emotional reaction the person's having. So the hot thought, it's not actually hot, but the idea is like you kind of follow the heat till you find the one that seems to have the most heat, and that's the hot thought. The way that I try and find the hot thought is I try and break a situation down to. So if we were to say, this would be better with an example, right? Do you want a mental health example, a dental example?
Let's do a mental health example.
Okay, cool. So my guy, right, I was just talking about earlier, so I don't have to introduce a new person. He has these ideas, I'll never be good enough, right? So I might say, and there's a lot of anxiety that goes with that. So there's a whole week to talk about, but I can't talk about a whole week, or we're not going to get anywhere. So when did you feel the most anxious this past week? Already we're kind of funneling it down. So we pick some situations that are the most anxiety provoking, and then from there we're going to try and funnel it further. So tell me about what happened in those situations. What was the worst part of the situation? And that we funnel it down. Okay, in that situation, what was going through your mind? With anxiety, it's a lot about prediction. So what were you predicting was going to happen? What were you afraid was going to happen? And then usually there's a few different predictions. And even from there, I might try and kind of, well, were you more afraid that you were going to fail, or more afraid that people were going to think you were a failure? Or we're kind of like trying to wiggle, is it this or is it that? And then once we find that, that's the thought that's causing the most distress, or the thought that's driving the problem behavior, that's going to be the hot thought. So my strategy is a funneling strategy, and I just talk out loud with the client because I have no poker face, so I can't pretend like I'm like subtly doing this, but I can say like, well, let's break the situation down. And I find it's helpful just to talk out loud in therapy in general, right? So let's break it down. Let me understand this further. So there's a lot of pieces here. Let's see if we can figure out what was the most anxiety provoking part. And then the client knows what we're doing, so they can follow along.
Okay. Can you give an example, like a scenario person, like something that you've just seen in your practice of like an example of someone maybe having issues with trust and how you help them work through that?
Right. Yeah, I see a lot. Usually I don't want the folks who have trouble trusting me, because I think therapists, we're kind of like naturally
someone in their life. They don't trust their sibling.
Okay.
Their best friend. They don't trust their best friend anymore.
Yeah, I got a lot of people who don't trust best friend, romantic partners. Boss happens a lot. Of course, boss is probably good to have a little natural mistrust, because they might be trying to exploit you. Anyways, the first thing we try to do is we try to understand, like, is this difficulty trusting this person, is this based in previous experience, or is there a good reason to mistrust the person now? Is this a red flag? Is a true alarm or a false alarm? And so in order to walk through that with the person, I might have to talk with them a little bit about anxiety. We evolved with anxiety to help keep us safe. I might say, anxiety can be like an alarm bell going off, and we're trying to figure out, is this a true alarm or a false alarm? And then from there, we can say, what would be the signs that you could trust someone? What would be the signs you couldn't trust someone? And let's see how that kind of maps onto the situation. As far as like trying to get someone to trust me, right? The most important thing for that is going to be just really trying to connect with the person in an honest and empathic human way, right? If people see that you care, if they feel that you care, if they see that you're trying to understand what's going on for them, that's going to get you pretty far.
What are signs that you look for? I don't know if it's something that you pick up or pay attention to when you say like, okay, this person is opening up. I think they're actually trusting me, like whether it's body language, tonality. How do you know that like you're getting somewhere in the relationship with you and your client?
Yeah. Right. Well, I mean, I think it depends on what you're working on with them. But usually there's some level of masking that happens just in our society in general, where for good reason, we don't walk around with our heart on our sleeves telling everyone everything about us. So usually as a therapist, there's this point that happens where they're like, here's what's really going on. Here's what's really happening. Maybe not that deliberate, but kind of more like, here's the real issue. In session, right? Usually you can kind of see people kind of relax a little bit. So if you were trying to wonder, like, how could I know if someone's really trusting me or not? You might just look to see, are they holding their breath? If they're holding their breath, they're probably anxious. If they're breathing normally, they're probably less anxious.
Okay. Yeah, just little subtle cues like that. Do you have, all right, so this is a question my wife wanted me to ask you.
Okay.
So like when you have problems in your own life, do you like ask yourself Socratic questions to work through them?
Yeah, absolutely.
So
absolutely.
like do you have like go-to questions that you ask yourself?
Well, yeah. So I think if I find myself in a situation where there's a lot going on, the first step is just recognizing what's going on. So focusing. So I might just try to cue myself into like, what's going on for me right now? Why am I so upset? Why is this really getting to me? Why am I so angry? Why am I so anxious? Why am I so sad? And then I'm going to try and figure out what do I think is really the heart of it. And then if I can find that thought, then not the model isn't that all of our thoughts are thinking problems, but the model is that how we think about it affects how we feel about it. So if I can find what I'm so upset about, then I can say, well, is this proportionate, right? Am I upset in a way that fits the situation, or am I making more out of it than it actually is? Am I missing something? If you get to know yourself really well, you kind of know what you're the way you tend to distort. You can go, I tend to take things more personally than I need to. Am I taking it personally right now? I am. Okay, this isn't personal. It's personal for me, but they don't mean it to be personal. All right, I could be angry about it, but not infuriated. I can deal with that.
Okay. I like that. I mean, I feel like I'm learning so much just from sitting and talking to you right now. I'm almost through all my questions, which is awesome. All right, here's one. So let's say that you're with a client and they're like explaining their side of the story. They're explaining their side of the story, kind of being one-sided about things. And then they go, do you think I'm being unreasonable? So if they say, if they say to you, do you think I'm being unreasonable? Like they're looking for affirmation and maybe they really are being unreasonable. As their therapist, how would you respond?
Right. So situations where that would typically come up would be if there's some kind of fight going on and the person is trying to like tell you like the he said, she said of it. And then they're like, well, am I wrong? Which they really are polling for you to be like, tell me I'm right. Yeah. And that's tough because, well, typically I try to kind of avoid that conversation and I try to cut it off before we get there because it's not therapeutic to rehash in what we call is ruminating, right? This is where you like a cow, where you ruminate kind of one stomach to the next. Humans do this, where we think about something, and as we every time we go through the story, we reorganize it and reconsolidate it till we self-radicalize ourselves, where we go from like he's being a jerk to he's an asshole, he's the worst, he's abusing me, I'm a victim. So as therapists, we try to interrupt this rumination that people do because the thinking doesn't get clearer the more they go through it. The thinking gets more jumbled. They tend to reorganize it in the direction of what their biases are. So if someone was to say like, am I being unreasonable or am I being right? I think I'm going to try and not fall into yes or no, because that's not really helpful, right? But I might try and say, well, I can see you're really upset about this. And we could talk about whether you're right or wrong, but I don't think that's useful. What I'd rather talk about is why this was so upsetting to you. Or I'd rather talk about why you're in this relationship still. I'd rather talk about kind of what's really going on here. Because a lot of people use anger as a way to avoid feeling afraid, avoid feeling embarrassed, avoid feeling ashamed. And if anger is on top, it's always a red herring. We're going to try and go for what's really going on here.
I like how you mentioned, like, I think you said interrupting them when they're ruminating. And I guess that, am I understanding that you interrupt them when they're doing that just to keep things from getting out of control, too emotional, too off track? Right. And again, it sounds like when you interrupt them, you just kind of say, you interrupt them with a question and say, well, how about we look at this, because I don't know if that's going to be productive.
Yeah,
Right?
if you interrupt them, people don't like to be interrupted, but it's important
Right.
to highlight, here's why I'm doing this, right?
Right.
But you're paying me an hourly rate to see me. You don't need to sit and ruminate in front of me. This isn't why you're seeing me. You're not seeing me so I can sit and watch you do this. So you can do this when I'm not here, but while I'm here, let's break this down. Let's focus on taking a more productive task, right? If I can highlight to you, like, you have limited availability to me, how do you want to spend it? That seems to work better than just stop doing this. This is annoying to me, because that's not really helpful.
Okay. Okay. Let me see if I have anything else here. That. Okay. So I like to keep these like under an hour, and we're coming up to an hour, Scott. I want to go with just like a parting question.
Okay.
Based on what you know about your experience going to the dentist, what would the typical dentist benefit from the most from the information that can be found in this book?
Let's see. So if I was to try and boil it down to like a caption, like if this was like a caption on a video, I'd say like people will listen to you more if you listen to them first. That would be the thing I would try and boil it down to. Socratic questioning is it's as much about listening to what people are saying as having good questions to ask.
Okay. With the questions, I'm gonna add one more. With the good questions that you ask, is there, I know you say people ask for like a list of questions to ask. I'm not gonna ask for a list of questions. Is there like a structure to questions that you ask that can be repeated? Like a question should have the following components to know it's a good question. I know that you touched on like,
interesting.
Someone said you should never ask why. I don't know why they wouldn't, but
yeah, the idea is that why makes you feel defensive, right? If you're like, why aren't you flossing? The person's like, I'm sorry, I'm bad, right? But what's getting in the way of flossing? Why is it harder for you to floss?
So I mean, to you, I mean, maybe it's not something that is like taught or you thought about, but like, what comes to your mind is this would be the format or structure of a quality question? Yeah. And this is my last question.
Okay, I like it. So in a very true to form style for me, I'm going to sidestep your question and answer what I think you're asking. So I think good questions are going to get at your understanding of what's going on. So I think if you can try to understand what the person is seeing, then you can try and see what are they not seeing. So really the question to ask yourself is, what are they missing? Okay. So I had a mentor who'd say there are two kind of blind spots. She'd say there's things you don't know and things you don't see. Actually, she would say, Scott, is this a blind spot or a dumb spot? And I never knew what she meant when she said that. I always just thought she was calling me dumb. It wasn't until like later on I was like, what the fuck did she mean? But she's really saying like, do you not know this or do you not see this, right? Because if they don't know it, then you need to help them. You need to provide that information. If they don't see it, you can say, well, what about this? We're totally missing this other thing over here. Okay. Because a lot of times people have missing experiences from avoidance, right? So for example, on the mental health side of things, there's a lot of times people don't do stuff because they're afraid to do it. Because they don't do it, they never have the experiences that go with it. Right. So, right, like, so for example, if I have a fear of being a failure, and then for me, failing would be the very worst thing. So what that means is I'm going to avoid things where I might fail at. And if it seems like I'm going to fail, I'm going to quit, because quitting doesn't hurt as much as failing does. So the blind spot is I don't know what it's like to really try. I don't know what it's like to really go for it. So if the therapist says, well, tell me about some of your successes, right? I'm going to say, I've never really succeeded at anything. I just try to not fail, and I'm kind of afraid of failing. Then I know, oh, okay, so what I know is that like they've never really gone for it. And also like they're definitely going to fail when they start trying. That's part of being alive, right? You have to fail to succeed. There's no way to unless you're born just like terribly rich and terribly beautiful, you're going to fail at something in life. Yeah.
Well, cool. Scott, how can any of the people who are going to be listening to this like see more of your content? I know you sent me a link to your Instagram. What's your Instagram, email if they have any questions? You can give that a shout out if you want. So the name of your book and your Instagram.
Yeah, sure. So the name of my book is, I think you already showed it, but I got it. There it is. Isn't that so pretty? I had
It's great.
I had this Canadian artist make it, and I'm totally in love with the cover. It was like a little bit of like a safety behavior on my part. I was like, well, if people don't like the book, at least they'll like the cover.
Yeah.
And the Instagram is Socratic Method CBT. So CBT, like cognitive behavior therapy. So yeah, I post daily about. I don't have like a ton of people who follow me, but it's just like me posting nonsense. Some of it's like therapy humor. Some of it's useful. I don't know.
Nice. All right, Scott, thanks for taking
This
some
was
time out of your day to sit
fun.
down and chat with me. I hope it was fun. I know
It
you
was fun.
never thought that like dentists would latch onto your book, but it
I
happened.
know. Whoever
Like,
says that they hate dentists, you got to say, you don't really know us.
You don't
right?
really know. All right, Scott, I appreciate it. Thanks for your time. Have a good one.
Thank you. Take care.
Bye.